Hello everyone, my name is Cui Wanting. I'm from Dalian Medical University. Is it just me, or are there other people here that are a little bit reluctant to go to the hospital? Why? It isn't because I want to avoid work as a medical student. When I was about 3 or 4 years old, my mom noticed that my eyes wasn't normal. Later on, I was taken to hospital. I don't remember that much, but clearly I remember that the doctor used the flashlight to check my eyes twice and said to my mom, "Your kid has hyperpresbyopia. There's no cure other than surgery. Otherwise, she may wear these thick glasses for a lifetime." And of course, I should tell you that she can be cured, but there are chances that dry eye disease may develop, and even worse, she might be blind after surgery. You'd better consider these risks thoroughly, and it's up to you whether to come back with her to have the surgery. Not to mention how terrified my mom was. Hearing the word blind, I cried my eyes out and begged my mom to take me to live here. Young as I was, I unconsciously associated hospital with fear and despair whenever I saw its white coats. Though this is not the end of the story, let's put it aside for a while. As I grew up, I gradually come to realize that the doctor was as professional as he can be, but that's not enough for an identification of a good doctor. What was missed is effective doctor-patient communication, which is an important part of the healing process. Effective doctor-patient communication has research-proven benefits. Patients are more likely to adhere to treatment and have better outcomes. They express greater satisfaction with their treatment, and they are less likely to file malpractice suits. Studies show that good communication is to teach a skill. Medical students who receive communication training improve dramatically in talking with, assessing, and building relationships with patients. These studies suggest that the interview is integral to the process and outcomes of medical care. Learning and using effective communication techniques may help us build more satisfying relationships with patients and become even more skilled at managing their care. Effective communication has practical benefits. It can help prevent medical errors, lead to improved health outcomes, strengthen patient-provider relationships, make the use of limited interaction time. However, due to the enormous knowledge gap between doctors and patients, patients are technically the weak side. The doctor's very top priority is to demonstrate empathy. Watch for opportunities to respond to patients' emotions, using phrases such as "that sounds difficult," or "I'm sorry you are facing this problem. I think we can work on it together." Studies show that clinical empathy can be learned and practiced, and that it adds less than a minute to the patient interview. It also has rewards in terms of patient satisfaction, understanding, and adherence to treatment. But can we learn something from my own experience? The doctor bluntly used the sophisticated medical term hyperpresbyopia, which confused a little kid a lot. What's worse, though it's the truth, the choice of the word blind got on my nerves. As a result, the doctor's should be extra careful about knowledge. Some words may have different meanings to older or younger patients than to you or your peers. Words may also have different connotations based on cultural or ethnical background. For example, the word dementia may connote insanity, and the word cancer may be considered a death sentence. Although you cannot anticipate every generational and cultural difference in language use, being aware of the possibility may help you to communicate more clearly. Try not to assume that patients know medical terminology or a lot about their disease. Introduce necessary information by first asking patients what they know about their condition and building on that. Although some terms seem commonplace, MRIs, CT scans, stress tests, and so on, some older patients may be unfamiliar with what each test really is. Check often to be sure that your patient understands what you're saying. You might ask the patient to repeat back the diagnosis or care plan in his or her own words. This can help with recall as well. You may want to spell or write down diagnosis or important terms to remember. Use simple, common knowledge and ask if clarification is needed. Offer to repeat or reword the information. I know this is complex. I will do my best to explain. But let me know if you have any questions or just want me to go over it again. Sadly, I didn't have the chance to ask more questions about my eyes. Do you notice that my communication with the doctor was like a monologue of himself? He just reeled off these words and told me to consider thoroughly. Since communication is the joint work of both sides, doctors should develop listening skills. On one hand, face the patient, maintain eye contact, and when he or she is talking, using frequent brief responses such as "okay," "I see," and "aha." Active listening keeps the discussion focused and lets the patients know you understand their concerns. On the other hand, it's not advisable to interrupt your patient. One study found that doctors, on average, interrupt patients within the first 80 seconds of the initial interview. Once interrupted, a patient is less likely to reveal all of his or her concerns. This means finding out what you need to know may require another visit or some follow-up phone calls. Additionally, facing facts, sometimes brutal facts, the patient undergoing shock and despair may cannot remember everything discussed during an appointment about their condition and care. Consequently, doctors can write down takeaway points. Older adults can especially benefit from having written notes to refer back to that summarize major points from the visit. Try to make these notes simple and clear, avoiding ambiguous and complicated knowledge. For example, you might write "drink at least 1/6 oz glasses of water every 2 hours" instead of "increase fluids." After talking about these skills, I think it's time to finish my story. So, what happened to me later? Instead of having the surgery, a vulnerable doctor introduced me to a unique therapy and suggested me to take the surgery when I literally had no choice. Every time I came for a follow-up visit, he would gently ask me how I spent my days. He would have me fix my eyes on a cute bunny doll while checking my eyes. even when my condition went worse, which means I need stronger glasses. He would comfort me with the warmest words in the world. Don't worry, we'll fix this together. Eventually, I got rid of these heavy glasses when I was 12. And the affordable and vulnerable doctor is the reason for my dream of putting on a white coat. Thank you.